Well, good morning. My name is Dr. Todd Davis. I am a developmental optometrist. Our profession is also referred to as neurooptometry. We are a very old specialty within optometry. Our first papers came out in the 1920s. We are a specialized group working with children and adults, really all ages, people who have visual processing issues. So today I want to present how early trauma affects vision processing. I'll be going through a fair amount of material. Hopefully this will be interesting and exciting for you to learn all these tidbits. And it's a field that I absolutely love, and I think you'll see that as I move along. I have a lot of spunk for what I do. Let me tell you a little bit about myself, and then I'll move on. I received a bachelor's Bachelor of Science at University of Oregon. I was, way back in the day, I was part of the football team, and then realized that I really needed to get serious about my studies. Then went on to, it's very hard to play college football and to be a serious student. So I wound up leaving football and getting involved with school. Went to Southern California College of Optometry for 4 years, received my optometry degree there. Discovered that I had myself a visual processing issue. I had been to other doctors in the past. As you know, when most eye doctors do a very critical service, they check for clarity, they check for eye health, but they don't look at other areas dealing with reading issues, for example, or problems with body coordination, and some of the items that we're going to be discussing today. So anyway, I started and finished optometry school with the idea that I wanted to go on and practice in the field of vision therapy, vision rehab. I did a one-year fellowship at Gesell Institute. Arnold Gesell was a pediatrician back in the 30s and 40s. He had a very tight relationship with our specialty. He's really the father of the developmental field. He was the first one to come up with normal developmental milestones, filming lots and lots and lots of children back in the day. So I was a fellow there, and since then I have done a lot of lecturing. I've been in private practice since that point. And my current office is called Virginia Vision Therapy, which is the bottom of the screen. We are throughout Northern Virginia. We have a number of offices. I have two other doctors with me, Dr. Amy Carlisle and Dr. Greg Johnson, and we do what we love. So this is just a very important service that we believe is so helpful. So I want to welcome and thanks for listening. You've seen these slides before, I'm sure most of you have, of these funky slides of people watching 3D movies. The interesting thing about 3D is that a lot of people struggle with 3D. 15% is the published percentage of people who have issues, but if you many of you listening will confirm that watching 3D is not comfortable. And the reason for that is that when the two eyes do not coordinate very well, two-eye coordination, by the way, is critical in development, but when the two eyes do not coordinate, which is called binocular vision, then one eye tends to take over. When you put the glasses on for 3D, it forces you to use both eyes. One eye has, even though you can see out of the eye, it's not processing in the brain. So stimulating both eyes with these glasses for many people induces nausea and headaches, and some people can't handle it. If you remember, 3D movies came in, and then 3D TVs, came in and went out because of the large amount of people who had issues with handling 3D. So let's talk about what vision really is. When we talk about vision, we're not talking about clarity. There's eyesight clarity, which is 20/20. Again, most eye exams are checking for 20/20, but they don't go further. In fact, of the entire visual field, everything that you see in your straight ahead and to the sides, only about 5% is straight ahead clarity. That's 20/20. All the area which which you've heard before, is called peripheral vision, is usually not tested unless there is some type of pathology or eye disease. Maybe there was a stroke or diabetes, that sort of thing, which is critical to check. But typically it's not part of a routine vision exam or an eye exam. So there's a lot of differences between us and the other our colleagues who do primary care, and we'll go into those later. So vision really is about understanding what you're looking at. I would suggest if you have a lot of connection with autism, perhaps have autistic children or other family members, that you get to know this particular author. Her name is Dr. Robinson, Ricky Robinson. She's at USC and out in California, not South Carolina. She has written very, very well about vision. She understands what vision is. It's about getting what you're looking at. So it's a brain function that we'll go into. This is a very good example of what vision is about. If you're looking at this blob here, some of you have perhaps seen this, perhaps not many of you, but if you look at this blob, there's a definite picture. And clarity-wise, you can see the black and the white and the gray areas. It's not difficult to discern the patterns here, but understanding the pattern it calls for a different particular brain function. It's a very different thing. So at the level of clarity, or quote-unquote picture taking, the lines, the black and white contrast doesn't tell you really what this is about. And if you look here, you can tell exactly what it is, and you can see it again if you keep on looking. And now your particular view of this is individual to you. Everybody's different in how they see. Your particular view is individual to you. And your experience with these animals plays a role in how you see them. Some people grew up with them on a dairy farm, and when they see a cow, there's a lot more experience attached versus people who grew up in the city and purchased their milk at the store. So the amount of cowishness, if you don't mind me butchering the word, it depends on your experience. So what you're looking at really depends on experience and your brain's ability to pull it all together. For example, another example is when you're looking at me, because of the cells in your eyes, you should not see color on the sides. Peripheral vision does not process color. However, your brain fills that in. That's why, and you do that individually. That's why at a God forbid, at a crime scene or an accident, the description of that event is completely varied. So you'll be within the ballpark, but there'll be a lot of details that you will miss that other people will pick up. And again, vision is in the brain. It's not in the eyes. The eyes just transmit the information, but it's really a brain function. Retina is brain tissue, optic nerve is brain tissue, which happens during the fetal stage. So it absolutely is. It has to do with the brain and not just the eyes themselves. It's very similar to speech. As I'm speaking, I'm articulating based on movement of my oral musculature, but all that is regulated through the brain. How I pull all that together is regulated through the brain. And vision also is really our dominant sense by far and away. And our brain receives about 3 million bits of information at every moment, but 2 million really are from the visual system. It's a huge system, far more than all the other senses combined. All the other senses combined, vision is a much larger processor. It's huge. Okay. And if I can go on here, here we go. And vision really is our, this is an important piece because, moving this piece up here out of the way, okay. Vision is really part of our position sense. Now this part I think is really important to pay close attention to. Position sense is a part of our brain that helps us with security, with safety. Safety is a huge part of our upbringing. Many kids who are, many adults having gone through childhood and have had a trauma know what it's like to feel unsafe and to feel insecure. Physically, the way we experience that is through this position sense. The position sense is primarily through the visual system, but it has immense connections with what's called the vestibular system, our inner system, which tells us body position sense, and also what's called proprioception. Perhaps many of you have heard of low tone. Low tone is a situation with people where they have very poor feeling of their body. And if our brains don't know where we are, we can't accurately locate where things are in the environment. So as I'm looking at the screen, my eyes have to converge on the screen right here, right in front of me. My two eyes come together, and that I can't judge that distance very well unless I know where I am in space. Now that's down at the bottom of the screen. It mentions autism. Autism primarily is a position sense issue. Kids don't know where they are in space, and that causes a great deal of insecurity. We do know that kids who have poor position sense tend to have anxiety. It's almost a one-to-one correspondence. Astronauts re-entering atmosphere, what's that about? Well, if you ever have the absolute delight of talking to somebody who's been in space, it's so cool to hear some of the details. But one of the pieces that happens is that when they come back into orbit, when they into the atmosphere, after being in orbit in a weightless environment, as their bodies come back online with weight, their vision becomes blurry for a while. It's almost as though the visual system has to recalibrate with that position sense. So again, if you don't know where your bodies are, it's very difficult to locate where things are in the environment. And the other thing is that vision is really the primary way that we think. For many of you, you'll really understand that when I say that you think in visual images. People who are very good with their hands, people who are engineer types, people who have huge mathematical brains, people who have what's called spatial intelligence will readily understand and actually feel that as I'm saying that to them. They'll know that when they think, they're thinking in terms of visual scenarios. Just imagine this morning putting together something to eat. You would have thought about the refrigerator before you would have actually opened the refrigerator. You actually plan out in scenarios very quickly as to what you're going to do. Dr. Arnheim spoke about this. He wrote a whole book called Visual Thinking, in which he says that it's a main way that we think, and we agree. And this character said, you can't picture it, you can't understand it. There have been many things, by the way, that are attributed to Einstein, and today they feel that half of it didn't, but who knows? But it's a friendly association anyway. And this person, Helen Keller, it made a comment years ago. It's a terrible thing to see and have no vision. She had excellent vision, and how could that be? How could that be? Because she didn't have receptors in her head through her eyes to be able to see, but she would actually visualize quite well, but through other senses, primarily through touch and feel. If you have a chance, if you're interested in this piece, I would go to YouTube, Turkish blind artist, Turkish as in Turkey, blind artist, and it develops this concept very, 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 very well. We'll talk about this in a little bit when we get involved in vision and development. In fact, we're going to go into that right now. And here's Ricky Robinson again, which again, she understands this visual piece very well. She says acquiring a functional visual system really is a developmental process, and we're all different. It isn't that we're given a set of eyes like a foot size or a hair color, but that's how typically the healthcare system views the visual system. Doesn't think about it in terms of development. The development's a very essential piece, and you'll understand in a few minutes why that is. We use a developmental model. Why? Because it really helps us predict where kids are, where adults are. Even adults can be missing some developmental stages. And a pearl to remember is that every movement system in the body rolls out on its own time schedule. Speech isn't fully articulated. We don't fully articulate expressive language until around 7, 7.5. We don't run until we're at a certain age. We don't have full use of the visual system until close to 6. So the idea is a lot of developmental pieces come together, but at different time schedules, and we'll go into that in more detail. One of the developmental sequences that I absolutely test for, and I love talking about this, is that we learn to see early on through our mouth, then to our hands, then to our eyes. So what does that mean? It means that a child putting an object in their mouth is doing so to help calm, to help for many reasons. But they're also, the brain is visualizing that particular object that's in their mouth. The brain can actually see the general shape of that when it's touching skin in the mouth. The mouth is very sensitive to that. At a particular age, early on, before the first year of age, and then all the way up through, I would say age 6, the hands are our primary learning tools. We're using hands to visualize. Remember, visualization is the key to thinking. We're using hands at this point to visualize and to learn how to think. Not until around 6, 6.5 do we then transfer to eyes, where I don't have to pick up this coffee cup to discern. I don't have to confirm with my hands what I'm looking at. I can look at something and I trust what it is. So at that point, we should be able to do that. We should have visual maturity. Most children can do that. Probably about 85% of the kids out there can do that. 15% or so, rough give and take a few, don't do that. And they're hands-on everything. You might identify that with some people that you know. So if I have a child who's 10 years of age and they're picking up some of the fidgets that I have next to my exam chair, and they're pulling and twisting, and they're grabbing the phoropter, that's that metal piece that we put in front with the wheels, and they're grabbing that and they're wanting to know how that works. I know that I'm not primarily looking at ADHD. What I'm looking at that point is a very, very curious person but they're still using hands to discern the environment. So this is a really important piece. So if I we say that they have a developmental lag in this particular area. Remember, every movement system in the body has its own time schedule. That's something, by the way, that Arnold Cassell talked about early on. It says my internet okay, never mind. Here's a paper that was done a few years ago, American Board of Pediatric Neuropsychology, talking about cognition and motor development. So thinking and movement. It depends on visual processing and fine manual control. Our hands are really critical. So for all of you working with young kids, I know that intuitively you understand that hands-on is critical for learning. It's important. I do have kids who come in who have not used hands. Perhaps they're in a family where both parents are working. It's not the parents' fault, but they haven't realized that Susan's not using her hands. And they don't realize that she's not really being tactual, not putting things together. And that causes issues often with, for example, with early letter memory or visualization of letters. So they're not getting a lot of visualization abilities because they're shunning hands. So that's important to know. A Montessori that is worth their salt will understand that if a child's shunning hands-on, it's not because their interests are in other areas. It's partly that, but they're doing so because there's a large deficit in that area, and they know to what to do at that point. Here's another developmental sequence, and that is primitive reflexes that we're all born with. You've heard of MORO, a Moro reflex, for example, where people jump and just at the drop of a hat. It's a startle reflex. And gross motor skills, fine motor skills. The way that we develop is that we are born with numerous reflexes. They're called primitive reflexes. Very interesting to look those up, by the way. There's a lot of detail in that whole movement area. And they give way. Normally, they give way. They reduce as we get older. They give way to big muscle coordination so that we can, by the time we're 5.5, we can ride a bicycle. But we don't have full fine motor control until gross motor or big muscle systems are developed to a point. Now, it's not a one-to-one. In other words, primitive reflexes come and go, gross motor develops, then fine motor. It doesn't work that way. It's an overlapping system, but gross motor is foundational. And with minimal interference from primitive reflexes. So we don't have full control of eye movements, for example, until we're around 6 years of age. Fine motor skills means small muscle, which also includes the oral musculature. So big reason why schools really need to think about starting kids at an older age. The #1 countries in the world that for literacy for educational systems are Finland's perhaps the top, from what I understand. I'm sure many of you would verify that or confirm that, but they don't start their kids till 7, perhaps. So it's because these skills take time. Kids who are early with lots of detail tend to come in the office with visual issues. They may have 20/20 clarity, but they have other issues that are a problem. So we especially see that in kids who have hyperlexia, not dyslexia, but hyperlexia is when they pick up books early on, which is a cool thing. They're able to read maybe even as young as 3, maybe earlier even. They pick up books on their own, no instruction, but it does cause some specific interference with visual processing. Here's an individual, looks like a character with his beret on. His name was Dr. Piaget. In the 50s, 60s, 70s, he was the most respected person dealing with child development. Since then, other theories have come about. But he really talked about the importance of understanding how primitive reflexes function and how they affect movement and also thinking or cognition. In the journal Dyslexia, there's some a lot of this is one article. There's information on primary reflexes and movement problems in kids with reading difficulties. So what that means is that if I have reflexes that are still very active, they're called retained early reflexes. That interferes with big muscle, which in turn interferes with fine motor control. So children who have retained reflexes often have scanning problems with their eyes. That fine motor positioning is affected because of the prevalence of reflexes. Not always, but that's a very, very common piece. I love this book. This was a major text that I fell upon a few years back, and it really lays out exactly what goes on, the concrete reality of human development, and that is we learn how to think through our bodies early on. Absolutely, like the child balancing the soccer ball on his nose. That's really important. So the original types of kindergarten is really, the type of kindergarten that I went through back in the 50s, it's really developmentally sound. And this was an article put out by Harvard Graduate School of Education that new data support a return to balance. What they're referring to is that movement, activity is terribly important. This was published 20 years ago, almost 20 years ago. So there's been a desire to pull us to slow down school entry that's really falling on deaf ears, and that alone is causing issues in schools. And this is now how kids are playing outside. Remember, if you're an old person like myself, you'll remember that you'd go out all day and spend all day. If it was snowing, you'd be out until dark, and there was just possible in those days to do that in most areas in the country, and not happening so much these days. Here's another developmental sequence that is critical. This has to do with that orientation piece I was referring to earlier, orientation or location sense. We also call it your inner GPS or global positioning sense. It all occurs within the body. Remember, we can't judge distances accurately unless our orientation system is well developed. Big advantage with lots of playground activity. Big advantage. Here's Arnold Gazelle. This book, still from the 1950s, is still available. Vision is development in infant and child. And I love this expression: a child's born with a pair of eyes, but not a visual world. And each child develops their own particular visual institute. So what causes these problems? Birth history, definitely. Usually when there's issues with children developmentally, where there's some lags occurring, some developmental delays occurring, it's usually in the area around labor. Somewhere during pregnancy, there were birth complications occurred. Prematurity is very, very common. Birth weight also, low birth weight is another area that can create developmental lags. Developmental history is important. Some kids didn't crawl well, did not crawl at all. So what does that have to do with developing brains? Well, it has to do with the brain working on crossing movement across back and forth across the midline to be able to transfer movement. So when we run, we have that coordination between both sides of the body. Later early walking can be an issue. Difficulty learning to run. That's not uncommon. Many times we know that our vision training programs, well, I'll talk about later, are doing their job when the parents come in after a period of time and say, boy, my child can really run now, so much smoother, and they're not clumsy as they were. Medical history plays a role. Genetic disorders. There's many genetic disorders today that are being identified. Serious illness, and we got to pay attention to Lyme disease, especially here on the East Coast, but also trauma, which I'm going to develop at this point. Emotional and physical trauma it causes a great deal of issues with interrupting development. And research is very clear that toxic stress from an unsafe, insecure environment really does damage to a child's developing brain. Many kids who come in are in we say they're in a flight mode. They don't trust. They have difficulty with being part of our program, but the brain's response to stress is either we move by fighting the stress, resist the stress, or we flight, we get away. Most people are very familiar with that fight-flight. But the third one is freeze. And that was developed through Dr. Porges, Porges, information on what's called the polyvagal response. So it has to do with part of the brain that is stimulated when you're trapped, when you can't move, when you're stuck in a situation where there's an unsafe environment, when parents are abusive and the child can't get out of the situation. And so they will tend to hide out, they'll move away, they'll withdraw easily, but they're unable to move. And that's the kind of stimulation that occurs, God forbid, when people are in airplane accidents, when they're trapped. Typically they pass out, and it's often called a vagal response. With children with these reactions, they have a hard time visualizing, a hard time paying attention in school. They have lots of difficulties with trust, even through adulthood, and developing healthy relationships with people. And the research has been very clear that there's increased inflammation. There's a marked increase in chronic health problems down in time. So to relieve the stress, people often will turn to drugs or alcohol. Nicotine can have the same impact. The activity escape, which is high-risk sports withdrawing, because that's a certain amount of safety doing that, especially with the gaming. That does cause a lot of issues with the visual system, by the way. And then overachieving, having to prove yourself by working extremely hard and oftentimes long hours. Another area that we see in our office is called dissociation. And that's where people literally do not feel in their bodies, or mentally they drift off somewhere into a safe area. They develop a scenario where they're safe, and they often don't realize that they're there. They may function, they may drive a car as an adult, they may do things, but they're in this other scenario. And it's more common than people think. So I'm not talking about full-blown psychosis of schizophrenia. I'm talking about a generalized feeling that I'm not in my body, and oftentimes that feeling can increase if I'm in a crowd, or if, God forbid, I'm in a booth at a restaurant and I'm surrounded by people. It will cause me to literally, quote unquote, freak out. My body just removes itself. So I have a feeling of safety and security. That's an important piece. The stress can go from generation to generation. We're understanding more of this through a field called epigenetics, where epigenetics, where genes are turned on or off depending on the environment, and we can activate stress response genes, and that response can be passed on to the next generation. This is a very important piece that I'm referring to in this slide, and it's referring to the ACE study, or the ACE test. It's Adverse Childhood Experience. CDC put this together. It was back in the 1990s that it first was published. Strong link between childhood trauma and later chronic disease and social emotional problems, and no surprise there. But it includes serious problems like heart disease, lung disease, diabetes, autoimmune diseases, and depression, violence, being a victim of violence, suicide. Many people that I see that are dissociating also have strong feelings of not wanting to be alive. These traumas tend to increase risks, and they found that it was far more common than they thought. In the study, these original studies were done in the Kaiser Permanente population, primarily Caucasian people, college-educated people they had access to healthcare, but they still showed increased amounts of chronic health conditions. The ACE is such that look it up online. There's lots and lots of articles about it. Only 10 questions, and if you score a 3 or a 4 or a 5 or a 6, that increases as the numbers go up. so does your chance of chronic health problems down the road. Over 70 publications through 2015, probably more since then, but it's really a standard today in looking at this in more depth, the damage that early trauma causes. Can't say enough about trauma and attachment therapists. Lots and lots of new types of techniques for this. In our programs, we work with people with dissociation, people who have issues with early trauma. Through our work, many people no longer have those issues. Many people do, though. It's not 100% effective in working through visual training programs. Not 100% effective for people, and so the appropriate referrals need to be moved on. Many kids with these issues are seeing therapists when they come in, but it's more cognitive therapy or behavioral therapy, and they aren't working with the parents haven't taken the child to someone who is highly trained with early attachment issues, early trauma issues. It's a field that is developed around these issues. There's also a lot of research on resilience, and that means people with grit in spite of these problems. Many of you, I am sure, have had a lot of issues early in childhood, and in spite of that, have been able to get through life. It's important that people to understand that the brains are plastic. Things can, in other words, neurologically, the brain can change, and people can improve their lives through accepting love, being able to be trusting, developing trusting relationships, and most critically, I think, is asking for help. That's a big, big piece, because people with these early trauma issues, you've got to understand, they're sort of done with others. They're going to be independent. They want to do things on themselves. It's very difficult to ask for help. I'm not a trained psychologist, but I deal with these issues all the time. So I don't go into the psychology piece of it with patients. We do work with people with especially with dissociation issues, because it's affecting the visual system. Now, let me talk about identifying these particular kinds of problems. Poor eye tracking, especially in autism, poor eye contact. Remember the impact of the child doesn't know where they are in space, high amount of permanent reflexes in children with autism, and they just literally don't know where to point their eyes. And so vision programs are really effective for this population. Poor tracking of print, poor attention span, have a hard time paying attention to details. Nystagmus is a movement of the eyes, very quick movement of the eyes that can occur in some situations, especially under a lot of stress. Another one is, let me develop this concept if you don't mind. Poor integration of central and peripheral vision. Now, it sounds like a mouthful, but it means that when I'm looking at something, the information around that, around whatever I'm looking at, is just as critical. That peripheral visual input is just as critical as what I'm looking at. In music, it's the harmonics, it's the background that's providing meaning to the melody, the central theme of the piece. Background is just as critical in sound as it is in vision. And many times people have issues in this particular area, especially after head traumas. So they have a hard time finding things. Highly distractible to anything to the sides. It's, we'll say, they can't maintain concentration what they're looking at. And am I hinting that ADHD has strong visual components? Absolutely, yes. And in fact, most kids with ADHD do have visual problems. I'll go out on a limb and say that. And there's plenty of information out there that supports that. And many times people have issues with objects moving or text moving when looking at print. And glasses with prism are very, very effective for this. There are color overlays that can help. but in long term, the prism in lenses is really critical for this type of problem. Another one is lack of visual dominance. I talked about earlier when I discussed the peripheral, the sequence from mouth to hands to eyes. And this is a child who is stuck. They haven't developed visual dominance, meaning that they trust their visual system, and they're still smelling and touching things, tasting things beyond early childhood. And recall earlier I said that binocularity is a real critical piece of brain development, very, very critical. It's important in reading comprehension. It's an overlooked area in education, by the way. It's an important piece for judging distances. People have issues with this see double. In the population of children that we see, about 8%, which is a lot of children, have issues with seeing double when they read. And many times, I will see a child where there's been a lot of testing done. They've really not found the reasons why this child's struggling so much. And within a few minutes, I'll determine this child is seeing double. And they might be in 8th grade, for example, and nobody's ever asked them. They've had many eye exams. Again, this isn't asked. This is a very critical aspect of determining during an eye exam, during a vision exam. Kids who have these issues and are on the spectrum often will side glance, will move their eyes to the side in order to see. When the brain does that, it automatically shuts off an eye. It's as though they're processing only out of one eye. So it's sort of a way of, quote unquote, blinding one of the eyes to move the head to the side. Prism lenses will stop that immediately so that the eyes can, what the prism does is it helps line up the eyes. Rocking back and forth also is it's a way of trying to stimulate this two-eye system by moving the head back and forth. Wiggling fingers in front of it, that's a visual stimulation that's a stimming for people in the spectrum or people who have had severe trauma. You'll see that. And also have a difficult time with judging distances. They can be, often they're clumsy, they bump into things. This is an example of double vision. There actually are many kinds of it. Unfortunately, there is a type where the print will actually move off the page, or there's a circular movement type. Sometimes there's a spread, or sometimes everything's together. There's no issue. These are words. All my fingers are words. And then eventually they'll start to spread. Then they'll come back again. They'll spread. They'll look away, blink. They'll do something else, and the words come together again. Then after a bit, they start to spread. That's not uncommon. Again, that's about 8–10% of the population, and you see that especially in early trauma. There is a lot of research in binocular vision problems. Convergence insufficiency is a type of problem where the two eyes do not coordinate very well. We call it CI, and there's a lot of information out there how kids with this are more than three times misdiagnosed with ADHD. They just can't pay attention at near. This was a study done a number of years ago. There's a lot of literature on this. Here's another issue. This is the vestibular input I was referring to earlier, the type of input that jet fighters are most interested in. This is these are signs and symptoms of people who have orientation issues. Sometimes there can be toe walking. We see a lot of that, or people touching walls. I see that with adults who have had trauma. They sometimes can spin and not be dizzy at all. They'll spin and spin and spin and spin. In fact, families will think it's kind of a fun thing. It's not, doesn't hurt a thing, but they'll have the child spin and then walk a straight line. And also very poor personal space. That's not uncommon when there's orientation issues. These problems are more common than you think. People will bump into things, poor coordination. Sometimes continual movement, lots of fidgetiness, lots of issues with that, and also car sickness is always a vision/vestibular issue. Poor visualization, especially when there's been a lot of anxiety, A child has issues many times with expressive language. They'll go somewhere with you, then you'll be at home, and the child's trying to describe the activity that you had just done, that you just completed, and it's hard to follow the child. Chronologically, things are out of sort, the sequence is off, often fragmented expressions, just hard to understand, and for sure difficulties with putting thoughts on paper. Again, visualization is really the key to thinking, and we use language expressively to express those thoughts, or we receive information receptively to pull in another individual's thoughts. So when we're speaking and listening, we're actually conveying visualizations, and we all visualize differently, and it's probably a really strong reason why communication skills are so important. It's very difficult to communicate in the best of circumstances. There's as you can imagine, high rate of poor self-confidence with these visual processing issues. So just in general, kids get very frustrated, adults get very frustrated. They don't want to do paperwork. I've run into people, especially, I don't want to go into it exactly, but people who are in fire and police vocations, they do not want to do testing because they hate the paperwork. They'll go somewhere and will not want to read because school was such a pain. In spite of their terrific intelligence, they don't like to read. Now, how do we manage these issues? We do so through, first of all, through specialized types of glasses. They're called prism lenses, and many times we'll use we'll use tint in these lenses, a minor amount of tint, often blue in color, but they improve where we are in space. 70-year-old young lady that I first evaluated maybe 3 or 4 months ago. Things have changed since because of COVID shutdown, but 3 or 4 months back, prescribed lenses for her. This person unfortunately was dissociating in terms of moving away from reality through thought, through different scenarios, and she didn't realize that how impeded her orientation, her ability to move through space was. She's actually a dancer, which is most interesting. But she didn't realize that when she'd go into a grocery store, she always stayed next to the person she was with. She never went in alone. She would stay next to the person she was with, and had a difficult time moving away from that person. First time with the glasses, she was able to do that, didn't realize what she was doing. She was walking about, also talking at the same time as she was walking. That's how impaired her orientation was. Typically when kids or even adults come in, when adults come in with these issues, they will have, some adults will toe walk, but mostly kids, and the glasses on, the toe walking either stops or it slows way down. And also increased visual attention. It's easier to pay attention. There's less work with something that should be unconscious, that should be easy to do. And side glancing, as I mentioned earlier, drops off. And again, that's for kids on the spectrum. But also you'll see that with kids who have had a lot of early trauma. Optometric vision therapy is an important program that we provide, and it's in office. We treat a number of issues. People have eyes that turn in or out. We work with lazy eye. We work with kids who've experienced a lot of trauma, people who dissociate, many issues we work with in vision therapy. For someone who's had car accidents, we call it rehabilitation. But we bear in mind that we're really treating the brain, and we're using a lot of techniques. Feedback, visual awareness are important pieces, and the neurological aspect is important. Remember, we're working with the brain and not with just the eyes. That's an important piece. And here is a interesting graphic that shows that. This individual, Norman Doidge, has written extensively on neuroplasticity. And in this particular text, he talks about vision therapy. And he's said that for almost 100 years, we've understood that vision can be trained. And today they understand that that's due to neuroplasticity or developing of new neural networks. And it's been a pleasure to have gone over this topic with you, all these ideas. I hope I didn't put you to sleep. And I do have the slide up for questions. What you can do is, if there's anything in particular, feel free to email me. Alana will with NewFound Families will provide that. Happy to answer questions through email that you may have. That any way I can help with this, and perhaps we can line you up with an individual in our field in wherever you live.